Welcome to the March Roundup of Coffee with Compliance. My name is Colleen Patterson, and I am the Vice President of Employer Services and Compliance here at Savoy. I will be recapping all of the happenings in the legislative and regulatory landscape over the course of the last month that are impacting employee benefits. So I've got a lot to go over in this month's recap, so let's go ahead and get started. So the first thing that I have for everybody has to do with a new rule that requires electronic information reporting for most businesses. So what I'm talking about is something that actually came out in late February, but was published in early March. And what that is the Internal Revenue Service had issued a final regulation that requires electronic form filing for common employer form series, such as Form W-2, the Form 1099 series, and of course the ACA reporting forms 1094 and 1095 series. So what happened is, as of January 1st, 2024, businesses that file 10 or more of these returns during the applicable calendar year, they're going to have to file electronically, at which point paper filing will become largely unavailable to employers. So for returns that are going to be due in calendar year 2023, the mandatory electronic filing threshold, it's going to remain at 250 returns. However, note that there's no change to the existing requirement that all Form 5500s be filed electronically, so that stays in place. Employers have to look at aggregating all applicable tax forms that they will be filing in the calendar year to determine if they satisfy this new 10 form minimum for mandatory electronic filing. Once the entity meets or exceeds that 10 form threshold, they have to file electronically. There's no option to continue with paper. So what does this mean in reality? So an example would be, let's say an entity issues 5 2023 W-2s and 5 2023 Form 1099s. They must file all of these forms electronically because collectively that's 10 forms. 5 W-2s, 5 1099s. And they're going to have to do that in 2024 when those forms are due. Here's another example. Let's think about a small employer that has 5 employees and they have 5 W-2s, but they have a level funded medical plan that requires them to do 1095B forms. Well, in that example, those two types of forms, the W-2, the 5 W-2s, and then the 5 1095Bs means 10. So that means that employer now has to file electronically, where they would not be able to file paper going forward. So this requirement is going to apply to the 2023 calendar year returns, including W-2s, 1094, 1095, as well as 1099s that will be due to the IRS in early 2024. So between now and then, affected employers, they really need to plan to switch to an electronic filing or find appropriate vendors that can assist them. Moving on to my next topic, it has to do with something that came from the Biden and Harris administration, where they had proposed a new rule to expand access to birth control coverage under the Affordable Care Act. Now, what I'm talking about is the IRS, DOL, and HHS, they had proposed a new rule that creates individual contraceptive arrangements for participants to obtain contraceptives without the involvement of their objecting plan sponsor that appealed the religious exemption and does not use the optional accommodation process. Now, under this proposed rule, a willing provider may provide contraceptive services directly to this eligible individual, and that is at no cost. So that begs the question, which is, well, then how does the provider get paid? Well, the provider will then seek reimbursement from a health insurance carrier participating in the federal or the state-run exchange, and that carrier in turn receives a reduction in their exchange user fees. So any objecting group health plan sponsors are not required to provide notice to participants of the availability of this process, although they are still subject to disclose rules that normally apply to group health plans. And of course, that means SBCs and SPDs and the distribution associated with both of those types of disclosures. Additionally, the proposed rule would rescind the moral objection exemption from the contraceptive mandate. So this means that group health plans that previously relied on this exemption would be required to cover contraceptive services. Now, this is again a proposed rule, and it does not make any changes to the exemption or the accommodation process for religious objection. Now, the other thing that I wanted to mention, because this one of the things when this hit the news earlier in March, is why is this happening now? Well, this is really a proposal that comes on the heels of the U.S. Supreme Court's Dobbs decision, which, as we know, overturned Roe versus Wade, and that certainly has heightened the administration's focus to access contraceptive services. So the agencies, although they've previously issued post-Dobbs FAQs, and that was what they referred to as Part 54. This new potential ruling is something that we are keeping an eye on, because remember, it is a proposed rule, so it's not definite, but it is something that we are paying attention to. So stay tuned to see how and what may change as a result. The next topic that I have for everyone has to do with the IRS that released a revenue procedure 2023-17. And what that addressed was indexed amounts for Section 4980H penalty amounts. So anytime you hear 4980H, bells, whistles, lights, flags should be going off, because that has to do with the ACA, specifically the penalties under the employer shared responsibility provision. So for calendar year 2024, the adjusted amounts will be for penalty A, $2,970, and for penalty B, it will be $4,460. So if we look way back to when this was originally put in place, these penalties are now almost double what they were when the employer share responsibility provision was first rolled out. So be aware that penalties have increased in 2024. Now, the next topic that I have is something that's been in the news, and it's kind of brought up some questions from our broker partners. So I thought it was important just to touch on this briefly. And what that has to do with is guidance that was recently issued on gag clause prohibitions. So as a reminder, gag clauses are contractual provisions that prevent pharmacists from discussing lower cost medication options with their customers. Specifically, this refers to the No Surprises Act, where these clauses are prohibited in pharmacy benefit management contracts. So employers that sponsor major medical plans are responsible for completing attestations to confirm that they are compliant with this requirement. So this includes employers that offer fully insured coverage, as well as group sponsors of self-funded and level-funded plans. So what exactly does this mean in reality? Well, groups with fully insured coverage, they should verify in writing that their carriers will be completing this requirement on their behalf, as should those that offer self-funded or level-funded coverage. Now, with a lot of these regulations, there's more of a lift for the self-funded community than there is for the fully insured community. So on the fully insured side, even though it says you should verify in writing, a lot of times it's that the carrier is proactively sending communication to the fully insured employer that here's what we're doing. So when that group receives the communication, they want to keep it in a safe place in the event that they have to refer to it at a later date if they were to ever be audited. Now, in the self-funded world, they want to ensure that they work with their TPA or their carrier administrative services and make sure that in the agreement, they are specifying language that speaks to, one, the gag clauses may not be part of any plan contract, and two, that the TPA or the carrier will file all required attestations on the group's behalf. So they want to ensure, if you're in the self-funded world, they want to ensure that it's written into their contracts. Moving on to my next topic, as we continue through the month of March, it was a long month, so a lot was going on. The next thing is the ACA special enrollment period for former or soon to be former Medicaid recipients. So we've talked a lot about this in the last month or so, and it's certainly been a lot of information that we have released in articles through our daily newsletter as well as on the website. And what I'm talking about is how the omnibus bill brought an end to the FFCRA's continuous enrollment provision. And as we know, that allowed individuals to remain on Medicaid during the COVID pandemic regardless of their eligibility status. Well, that ended on March 31st, 2023. So in response, CMS is opening an ACA special enrollment period for those that are losing Medicaid coverage after the end of the continuous enrollment provision. So the special enrollment period, it's going to run from March 31st, 2023, all the way through July 31st, 2024. Now, eligible individuals, they'll have 60 days after submitting their application to a select healthcare.gov marketplace plan to actually enroll in the coverage. And as a reminder, the coverage begins on the first day of the month following their plan selection. Now, this is important because it's anticipated that more than 18 million individuals are expected to be affected by this change. And I mention this because there was a recent survey that came out by the Kaiser Foundation, and the survey specifically addresses Medicaid and children's health insurance programs. And what they were talking about is how are states starting to prepare for the end of this continuous enrollment. Now, what we've already seen and we've already received some questions on is that states are starting to be proactive in identifying this population and making the population aware of what their options actually are. But there also are a lot of states that are struggling with how to do that because they have systems that are antiquated. But the bigger issue is that all of these states are dealing with staffing shortages. And that is going to be challenging for these folks that suddenly may find themselves no longer eligible for the Medicaid program and without coverage. So it's important to note that in our footprint, and specifically, I'm going to mention a handful of states here, but this is happening across the country. But in our area, we're talking about Pennsylvania, New York, Connecticut, New Jersey, Delaware. Several of these states have already started their communication with the population, and more states are expected to do so. I bring this up though because the challenge to the broker community is that there's going to be folks asking a lot of questions because they're going to go seek care and suddenly find out that they don't have coverage because there are some delays in the system, delays due to lack of system capabilities and the shortages in staff at the state level. So just a heads up to everybody to be prepared that this is likely coming. And we're already seeing these notices are going out, and they have gone out already in several states in March. And we are hearing from several state departments of insurance that more notices are going out in April. So that's going to prompt questions from this population to their employers asking for assistance. How do I get coverage? Do I look at the marketplace? Can I come onto the group health plan? So to make all of our broker partners aware that these questions are sure to be coming. Now, the next topic that I have has to do with the National Medical Support Notices. And this really impacts what had happened here was that the Office of HHS, so specifically the Office of Child Support Enforcement, they had released FAQs last year that were talking about a new free voluntary online system where the electronic exchange of the National Medical Support Notice between state child support agencies and employers, plan administrators, TPAs, and unions was now available. So as background, a National Medical Support Notice, it's a standardized medical support enforcement document that the state child support agencies send to employers to enforce a child's right to health care coverage under a parent's group health plan. Now, we all know this to be QMCMOs, so where it's a qualified medical support order. And it hasn't changed that, but here's what has changed. They are now coming out with a new form, and that new form is going to be available on the electronic system, so some states are using that, but also the paper form that is going to be going to employers is new. And we've already received a couple of questions about this, so I wanted to share this with the broker community, because if you are processing enrollment forms where this is a document that accompanies that, I want you to be aware that that these new forms are lengthier and a little bit more detailed than what they were before, and it's causing some confusion. One thing that remains in place is that in the event that this comes up and an employer is asked to complete it, they have to do that timely and make sure they follow the instructions. But please know that it is a longer form, and when this new form has to be used by agencies is November 1st, 2023. It's optional right now, but it will absolutely be required by November 1st, 2023. And that's just in time for the fourth quarter volume that everybody deals with. So I wanted everyone to be prepared that you're going to start seeing these new forms coming out, and already lots of questions have been asked as a result. So moving along, the next thing that I wanted to mention to everybody as we get closer to the end of the national emergency, what does that mean for COBRA notices? Particularly, what does that mean for employers that administer some or all of their COBRA functions in-house? Well, they really want to take the time to update their notices to specify the election periods and premium payment deadlines, because we're going back to pre-pandemic rules. And if they are doing that in-house and they haven't updated their notice in a little while, it's very important that they do so now. They also want to make sure that they are clearly communicating any changes in deadlines that may impact current participants. So they definitely want to start getting their ducks in a row. And it may be another opportunity to have a conversation with those employers that do this administration in-house, that they may want to look to a third party for assistance and outsource that. Now, the next topic that I have has to do with RxDC reporting, and this is everybody's new favorite phrase this month because it is everywhere. So most recently, and this just happened about a week or so ago, where CMS had released the 2022 instructions for the RxDC requirement. Now, if you're like me, I was wondering, well, my goodness, why are we just now hearing about instructions? We've already gone through one cycle of reporting. Well, the reason for that is because they've learned a lot after that first round of reporting. So let me just take a second here and just as a reminder, explain that RxDC is the new federal health and prescription drug claims and plan spending reporting requirements that affects all employer groups of any size and any funding structure. So really nobody's exempt from this. And the 2022 instructions, they clarified some things that lots of folks had questions about. And specifically, those instructions clarified that this RxDC reporting requirement does not apply to retiree-only plans. Also, that means that it just applies to traditional group health plans in the US states as well as its territories. And that's been a question that's come in multiple times as well. So over the last several months, we've spent a lot of time talking about this topic, and we've kind of dove in a little bit to what the different data requirements are that are in these files. So to recap, RxDC reports from employer group health plans must include a file of general plan information. And that's what's being referred to as a P as in Paul, P2 file. And also details about the plan's enrollment information and allocation of premium dollars. And that's what's referred to as the file D1, D as in David, so D1. And there's a bunch of other requirements too, and those are in files D2 to D8. And it primarily reflects statistics about prescription drug usage and medical claims data. So the carriers are handling all of that. But what we've been seeing is the carrier community recognizes that there's information that they don't have. And that information falls into this D1 file and this P2. So the D1, again, is about the allocation of premium dollars and enrollment information. And P2 is a file of general plan information. So carriers have been sending out surveys asking for their employers, clients to complete these surveys in a period of time. Well, the issue that has arisen as a result of that is they're asking for some of this information to be turned around in some cases less than a week. And employers who may not be on top of recognizing that they have to do something with this could be missing a deadline. Well, the other thing that the instructions did address is because the carrier community doesn't have all of this information, and because carrier also includes other entities such as TPAs or PBMs, that means that information could be coming from multiple places. So now, if you factor in the fact that an employer group may have missed that request to complete a survey on time for the carrier, that means their information could potentially go incomplete. And at the end of the day, it's the employer's responsibility to ensure that the information in these data files is complete, accurate, and timely. So what happens if an employer misses the survey deadline that a carrier has imposed on them? Well, there's now third parties that have come to light that are saying that we can send this information on your behalf too, specifically the information that's in those D1 data files. And again, that's the premium allocation. And what we mean by premium allocation is that's the employer-employee contribution split. A carrier is not going to know that, but they need to know that for purposes of adhering to these RxDC reporting file requirements. So in the event that an employer missed that carrier deadline, there are third parties now that can send that information. And these new instructions included details on how the information from all of these multiple entities being a health insurer, TPA, PBM, or a third party to submit the missing data, how they can connect the dots for the same employer. So the information about that is out there, and there are now companies that can help employers who may have been missing some information get it done and get it done timely. Now, the last thing that I just wanted to mention here, and this is just, again, one other reminder about the end of the continuous enrollment provision. So specifically New Jersey as well as Delaware, at least as of the end of March, those departments of insurance have come out addressing specifically how their individual states are going to monitor, adhere, and implement the end of the continuous enrollment provision for the population of Medicaid enrollees who may be losing coverage. So definitely keep an eye out on the state level, because we're starting to see, and this was just within the end of March, states are starting to release how folks in their individual states that are being impacted by this, how they can seek care, what kind of resources are available, and the timelines to be able to find care. So keep an eye out for that, as we will continue to release that information as it becomes available from each of the states. That's going to wrap it up for me this month. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use all the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe, and thank you for listening to us today.